Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? If you follow me on Instagram, you've seen recently my obsession with facial plastic surgery. And what did Lindsay Lohan do? I want to know. So today I'm super excited to have a very skilled and very talented plastic surgeon, Dr. Sean Delaney from Houston, Texas. And he's going to help us navigate through some of the ins and outs of facial plastic surgery, the terms that we're hearing, and what's really going on to get this beautiful reverse age look. Thank you for being on the show, Dr. Delaney.
Thank you, Mavi. Thanks for having me.
I'm super excited to really just dive into it. I get so many messages about, is this true? Is this true? So I was just telling you off camera, I got a message yesterday from a patient who asked me, is it true that only 10% of facial plastic surgeons can do a deep plane facelift, and that's why they cost $100,000?
That's an interesting figure. So I would say it's probably not true. I think deep plane techniques have started around the 1990s, and they've continued to improve. I would say it's probably more than 10% of surgeons, facial plastic surgeons, who could do deep plane. But we have to look at maybe some recent surveys. I think 10% sounds on the low side. And a deep plane facelift certainly would not cost $100,000. A lot of it depends on the surgeons themselves, the city, what kind of market you're in. But I think most patients can find a very good deep plane facelift surgery at a fraction of that.
I agree. I 100% agree. One of the things I want us to decipher for our listeners is the different types of facelifts and why the deep plane facelift is what everybody's looking for.
Yeah, that's a great question. And, there's so much confusion when it comes to facelift terminology. There's a lot of mixture of marketing terms that, different docs will have. I mean, you've probably heard of mini facelifts, weekend lifts. So it's really hard as a patient to figure out what exactly, they're looking at. So as a doctor and you, Mavi, also, it's our job to help kind of explain things. So patients could be a little bit more educated. So a deep plane facelift, what makes it a deep plane? So the way I like to break it down is I think of the face as a layered cake. Okay, so when I'm trying to conceptualize, I'm thinking of the face in layers, and there's basically 5 layers to the face. You got the skin, the fat, the SMAS. Okay, so you probably hear the SMAS come up a lot when people are talking about facelift, and so that's really where all the work is done. Okay, and then underneath the SMAS, layer number 4, that's the deep plane. Okay, the deep plane is a potential space. There's some blood vessels and nerves that course through it, but really there's not much there. And then layer number 5 is whatever the deep structures are. So that deep plane is layer number 4 under the SMAS, and that's where we could get the most pull, the most natural pull, and the fastest healing, because in that potential space, it's a potentially avascular space. So we don't have to cut through a lot of vessels to move it, and then it's a glide plane, and that's what allows us to move our facial muscles and have our facial expressions. And then so there's another really important distinction when it's the deep plane. And this is something I have to explain too. So any surgeon can call their facelift a deep plane facelift as long as they enter the deep plane. And it's very confusing because they can enter the deep plane here. There's all sorts of different approaches. But once you enter the deep plane, what you do also matters, right? So if you just enter the deep plane and pull a little bit, you could call it deep plane. you can enter the deep plane and go all the way to the nasolabial fold, the corner of the mouth, and release all the facial retaining ligaments. And that's also called a deep plane. So uh, just knowing that yes or no, it's a deep plane surgery sometimes isn't enough. So you definitely want to do your homework and ask the surgeon, what do you do once you go into the deep plane, so you get a better idea.
So what should they hear? So I like to, for my listeners, what should they be? Um, what questions should they be asking at that consultation to really get the information that they need to decipher, like, this is the procedure I want, or this is not the procedure I'm looking for?
Yeah, that's a really good question because there's so many different facelift types, and there it's not a cookie cutter one size fits all, right? So depends on what areas bother you, then you can kind of figure out which type of surgery is best for you, right? So um, a common area that bothers a lot of patients is the nasolabial folds, right? Over time, they see the folds get deeper and deeper, and they'll get filler injected here, but that's not the problem. We don't lose fat in the nasolabial folds, is this coming down, all right? So if this is the primary area that bothers them, the downturned corners of the mouth, you really want an extended deep plane that can get down to there that lifts. Now, with an extended deep plane, the key about that is it's all about releasing the facial retaining ligaments, then allows us to redrape that. Now, if your only problem is jowls here and you don't really have any issues out here, you may not need or require an extended deep plane. A regular deep plane that gets down here and lifts up the jawline tissue, it may be all you need. So um, there's a lot of nuances to it, so it's really important, and I appreciate you sharing this information with patients. So it's really important to figure out what you want and what you're trying to go after.
So typically for my listeners, their age ranges are anywhere from like 25 to 65. So I have a wide listener range
Yeah.
age. But the majority are between that 30 to 50
Mm-hmm.
range, the ones who are looking for facial procedures. And what I've noticed is that a lot of what that bothers them is
Yeah.
that central area.
Yeah. And so one of the reasons that I started performing the extended deep plane, it's obviously a little bit more difficult and takes a little bit more time, is precisely because other techniques don't really address these areas well. And then what you can see sometimes is doctors will compensate by pulling tighter on the lower half of the face, and you could get this sweep. It's called a lateral sweep deformity that you see maybe not right away, but a year after surgery. So really, to get into here, you need to ask your surgeon whether or not they release these ligaments, which then allows you to redrape the tissue naturally rather than having to pull the surrounding tissue so hard that you overcome that ligament.
Oh, I love. Are y'all listening? Y'all better be listening because this is some real juice right here. Okay, so besides the deep plane facelift, what other procedures are being offered out there for this particular area?
So I think the important thing to first say is, there's a lot of procedures offered for this area that don't work well. And we get a lot of patients who come to us, they're frustrated because they've gone through, their progression of injectables and non-surgicals, and they're still in the same spot, right? So I would say starting off, fillers, you have to recognize what they can and can't do. So fillers here at the piriform recess can help a little bit because over time we do lose bone and you lose some volume there. But filling in the nasolabial folds is not gonna really do much. Other energy-based skin tightening treatments simply just aren't effective because really they're treating superficially, but the problem is that deeper layer, that SMAS, right? So unless you could get into layer 4, that deep plane, and lift everything up together, anything else, won't really move the needle very much. And we've certainly seen other treatments like thread lifts. And I just ask, that if you're considering thread lifts, see if you can find any long-term before and afters. They look great on the table, but if you're looking for long-term results, I would challenge you to try to find them because in our experience, they don't last. They have definitely their own complication risk profiles. And then when you do surgery later, they could be in all sorts of different planes that interfere with your surgery and cause scarring. So there's a lot of ineffective treatments for that area. And so I just want to caution, our patients, don't err on the side of trying to avoid surgery, but end up making your future surgery a lot more difficult.
You just touched on something that I was going to ask you because I've heard it not just from other surgeons, but I've seen it online. I've heard this, and I know it's not a myth. Tell me what you've seen in your practice as far as collagen producing treatments, like,
Mhm.
for example, Sculptra or Radius, and or threads while you're doing a facelift.
That's a great question. So I think there's a role for a lot of these biostimulators, right? So Sculptra is a common one we think of. Radius to a certain extent, like I inject it, we'll inject it as a dilute form, so it stimulates collagen and elastin production. There's PDO threads that aren't barbed that stimulate collagen production, and a few things. One, we have to recognize like what they're doing, right? They're a foreign body substance. They're causing inflammation, and as a response, the body deposits collagen. Right. At first, it's similar to scar tissue, and then it becomes more organized and it becomes sheets of collagen. So, when properly used, there's definitely benefits to that. It becomes problematic now if, let's say, the injector is trying to replicate surgical results with it, and they're injecting these biostimulators in the wrong planes. And
Mm.
then that's when it can affect your surgery. So, for instance, when I inject Sculptra, it's deep dermal, right under the skin only, because we want to try to stimulate collagen production, right? And so, for example, I was doing a brow lift about a few weeks ago, and this patient had a lot of Sculptra injected into her temple. And her injector injected all the way deep to try to build up volume, right? Uh, and to her, it's the patient, it sounds like a great idea, right? I could get volume, and this is a biostimulator, right? So what can go wrong? So I'll tell you, in the surgery, all the tissue planes were stuck together, and it made for a much more challenging procedure. So um, these biostimulators, I think, when injected in the right plane, don't cause a lot of problems. So, like for a deep plane facelift, we dive deep pretty soon. So if the biostimulators and the collagens in the subcutaneous plane, not a big deal. But if there's barbed threads, or if the injector injected deep, crossing those different planes, injecting it into the deep plane, which should be a nice glide plane, now it's stuck together, and it makes the surgery much more difficult, much longer, and more risky as well.
What about threads?
Yeah, so the PDO threads, if they're placed superficially, they
Barb
cause
threads.
barbed threads are a different matter. So, yeah, barbed threads could cause scarring, especially if they go deep, right? So, barbed threads are meant to grab skin and lift, but sometimes, providers will try to grab SMAS and lift, and then so you have the barbs going through different planes, and sometimes they're in the orientation of the facial nerve in the deep plane. So then it becomes much trickier, right? Because you have everything stuck together, scarred down, and now you're trying to figure out, okay, is that a facial nerve? Is that a barb? Uh, and it's a whole lot of extra risk for your surgery for a very temporary and very small potential benefit from the barbed thread lift.
Absolutely. So, one of those things I like to tell my girls is if the procedure that you're doing to hold off a bigger procedure, for example, like going in for the full shebang,
Yeah.
it might not be the best idea. And you might want to save that money that you're going to spend on those threads or whatever procedure that you're going to be doing and just put it towards your facelift because the full result that you actually want will be with the surgical procedure versus the non-surgical.
That is such great advice. I have so many patients coming in wanting surgical results, but they're afraid of surgery, right? So then I'm very upfront with them. You're not going to get a surgical result with non-surgical treatments or minimally invasive treatments. So any patient who goes like this, that's surgery. There's no getting around that.
So, one of the things that I want to touch on is prepping the skin before facial surgery. So, if you're listening, prepping your skin is like when you're saying I'm getting ready for surgery, this is one of those things that you're doing when you're getting ready for surgery, prepping your skin. So, do you have a protocol, or what do you usually recommend for your clients?
We do, for patients who have enough lead time coming up to their surgery, it's always great to prepare the skin, right? Get the skin in as healthy of a state as possible. So then once you have those incisions, it heals a lot faster, right? So obviously getting them on a good skincare regimen, and we don't have to go into the basics of that, but probably the one of the more helpful things is getting them on a retinol or a tretinoin cream. So your skin turnover is faster, your skin's healthier, so it's primed to heal after the surgery. It's important we stop them about a week before surgery to allow the skin to kind of recover from that. And then also importantly, some of our patients who want to do everything possible to have the easiest recovery, we actually set them up with hyperbaric oxygen therapy. Okay, both 1 or 2 sessions before and immediately after. And what that does is it pumps in extra atmospheres of oxygen into your bloodstream, and that helps you heal so much faster. So if you do it before surgery, that gets your oxygen content higher, so you heal a lot better too.
Wonderful. How long before the surgery do you usually have them do it?
So we usually have them do it, like a few days before. So, if they're having surgery 2, 3 days before, 1 or 2 sessions. And this way they also become familiar with what the protocol is like. So afterwards, when they're trying to recover from surgery, it's not so much of a novelty.
Let me tell y'all why he's saying that. He's saying that because sometimes getting into the hyperbaric chamber and being in the hyperbaric chamber can be a little bit of a anxiety causing experience, because if you have claustrophobia, if you don't
Yeah.
like being in tight spaces, it could cause some anxiety, even if you're not somebody who has that before or had dealt with that before. You guys know that after surgery, your emotions are a little more, you're a little more sensitive. Things that wouldn't bother you before might bother you now. So that's why he's saying, just so you can get ready and know what to expect when you go in there before the surgery, after the surgery.
Yeah. Very good explanation.
So, one of the trends I want to talk about is what they're calling the everything all at once trend. So, what does that mean?
Well, a lot of times our patients, they've been waiting a long time for getting some procedures done, right? So, uh, and they're like, this is it. I'm going to do this once, and I don't think I'm going to come back for any other procedures. And we have a lot of patients where we do that, where it's like, it's everything. We do top to bottom, forehead, eyelids, lip, neck, face, laser, fat transfer. And so it's a one and done. Obviously, it's a much longer surgery, so you got to make sure that they're healthy enough for it. But you combine all those recovery periods in one.
Mm-hmm.
And obviously, it's a little bit harder of a recovery with every additional procedures. So we make sure you have a lot of support, both from us, and you need to make sure they have support from home. But it's a one and done thing, so then they don't have to worry about getting any surgeries for many years after that.
So, when you are aging, right, your face kind of everything starts to come down.
Yeah.
And the everything all at once means we're addressing the brow area, usually with a brow lift. And then if we go into the different types of brow lifts, we'll be here forever.
Yeah.
But we can touch on it a little bit. So usually they do a brow lift. Um, Either if the brow lift does not get rid of the excess skin above your eye, in your eyelid, then usually a bleph or
Mm-hmm.
a lower bleph, depending on if you have eye bags or not. The mid face, so mid facelift and neck, and and maybe a lip lift
Yeah.
at the same time. Do you do rhinoplasty at the same time as an all everything all at once, or is that something that you like to do independently?
Yeah, it depends on like if it's truly full face, then we would keep them separate because it's a lot. It's a long surgical day, and with the rhinoplasty, that's one of the hardest surgeries. We just really want to be able to focus
Yeah.
on that. So if it's like rhinoplasty plus one or two things, we'll do it together. But if it's everything at once, we usually separate them.
Yeah, that's what I thought. That's what
Yeah.
I figured because that might be a little too much. And then on top of all of that, so now you did brow, eye, maybe upper and lower, mid, neck. And then on top of that, you add the icing, which is the fat grafting, that
Mhm.
beautiful fat to fill in some of that volume loss that you've had over the years. So let's talk about fat grafting.
Great, great. It's one of my favorite procedures to do.
Mine too.
Okay, so I'll talk to you more about kind of facial fat grafting, right? So, um, when I look at facial rejuvenation, just to kind of take a step back, I look at what happens when we age, right? So, when we age, most people think of the laxity, okay, but in fact, much more happens, in addition to that. So, we go through some involutional changes of our skin. Skin becomes thinner, it loses its elasticity, we lose fat, so we lose some facial volume, and then also our skulls change. So our skulls shrink in different places. Um, so there's some things we can fix, some things we can't. So the skeletal changes, not much we could do. But for the fat loss, we could add volume back, right? And then facial fat transfer involves taking fat from elsewhere in the body, much like fat transfer anywhere else. Most common places we'll harvest them from is from the lower abdomen or from the thighs. Even in thin patients, sometimes they'll have a little area that is, resistant to weight loss, and we don't need a whole lot. But then we would harvest that fat. We harvest it differently than you would when you undergo body liposuction because we want to be very gentle with that fat. We want to as many of those fat cells or the adipocytes to survive. So we harvest that fat. We carefully purify it, and in the face, this is really important. We reduce the fat into microfat. So little droplets of fat that are 2 millimeters or less, because we're transferring into the face, and we're transferring the face in areas where the skin is very thin. So a common concern that I hear a lot is, will I get lumpiness afterwards? So by making sure we create microfat from the harvested fat, we really significantly reduce the risk of that. Now, the injection in the face is also very important because the fat graft, it's a free graft. Okay, so it doesn't come with its own blood supply. In order for that fat to survive, it needs to be within close enough proximity to another blood source in the face. Usually that's like a millimeter, millimeter and a half, in order for it to survive. So in order to maximize the survival, we inject it in multiple planes in a fanning motion in very little droplets, so they're not too clumped together. Because if you have a big clump, only the edge will survive, everything in the middle will go away. So we try to spread it out. And usually it's not just one area. We usually blend different areas, so you have a very nice, a very natural rejuvenation. Um, as I kind of hinted a little bit, not all of the fat will take, so there's a certain amount that will be reabsorbed. And then also, probably what I love the most about fat transfer to the face is I see these skin changes beyond just the volume addition, because the fat cells themselves have nice growth factors, and then there's mesenchymal stem cells that come with the fat. And the skin really looks so much better afterwards, and that's just an added bonus to having the volume restored as well.
I love that. I am considering it for the future. So I'm excited to hear all of the different things that are taking place to make sure that the fat that I have does survive. How much is the average? Because my girls usually we hear averages of how much is being injected in the booty, but
Mm-hmm.
how and even we've even talked about averages for breast. What is the average amount of fat transfer to the face?
Yeah, that's a really good question. So you're going to hear much lower volumes than the body, right? So let's say it's an older patient, maybe in her 70s, and she needs everything volumized. So we'll add some to the temples, above the brows, above the eyelids, under the eyes, cheeks. geniomandibular grooves here. Um, and then if she has hollowing here, so we could easily get up to almost like 40 cc's. Okay, so nothing compared to what you see in the body, but 40
Hmm.
cc's is a lot for the face. It sounds like a lot, but when you spread it across the whole face, it's actually very, very natural. It's not like you're putting 40 syringes of filler all in one spot.
Right.
And we do have to recognize that some of the fat will reabsorb. We usually get about 60% take, so some of that will come down a little bit. But we'll have younger patients, those who maybe have hollowing just under the eyes. So we'll build up their cheek, blend under here, and they may just need maybe like 16 or 20 cc's to really get a nice result. So I would say probably somewhere in the teens to the 40s.
Beautiful. So that's why even my skinny girls we can find at least a little bit of fat somewhere.
Exactly. It doesn't. Sometimes you don't need a whole lot. Now, I do have some patients where they're avid runners or work out a lot, and I'm like, please just gain a little bit of weight so I have something to work with. Because when we harvest the fat, we want to make sure there's enough fat that we could get it from the deeper compartment, so you don't have any contour irregularities
Right.
above. So we always want to make sure that we take care of the harvest site too.
Something I was going to ask you when we first started, but then I got right into it was
Yeah.
what are the special, let me rephrase that. What is the difference in training for a facial plastic surgeon versus a body plastic surgeon?
Yeah, that's a great question. So you'll find that most facial plastic surgeons have first completed an otolaryngology head and neck surgery residency, right? So um, that involves everything surgical and medical from the neck and up. And then most facial plastics fellowships are otolaryngologists or ENTs that go into it. There are some rare instances where we'll have doctors from other specialties, but for the most part, if you see a facial plastic surgeon, is generally someone who has had an ears, nose, and throat background, who then did additional year of training in facial plastic and reconstructive surgery. And this is a really good combination because basically we spend 5 years training everything from the neck and up, and more than just superficially where we do a lot of our cosmetic surgery now. In my training, we've done surgeries where we did laryngectomy or take out the voice box, or thyroid surgery, or parotid gland surgery where we work on the facial nerve. So when we do the deep plane, we're familiar with the course of the facial nerve and it doesn't scare us. We work inside the ears, inside the sinuses. It makes a lot of sense for nasal surgeries, right? Because ears, nose, and throat doctors treat breathing. They could take care of inflammatory conditions. And then with the plastics training that they get, like for us, we make sure the nose looks good and breathes well as well. So it really lends to a really good kind of overall specialization of this area. Now, for plastic surgeons or PRS, plastic and reconstructive surgeons, generally there's two pathways, right? More traditionally, they'll go through a 5-year residency in general surgery and another 3-year fellowship where they train everything head to toe. But in more recent years, there's the integrated programs. So for those applying to residency, knowing that they're already interested in going into plastics, the integrated programs have 3 years of general surgery where they focus on mainly the abdomen and the chest, and then 3 years of dedicated plastics training. So they definitely have a much broader scope of practice, and they truly are the experts at taking care of the whole body. And some of them choose to remain very general, where they do everything. Some end up focusing. Some end up doing just facelifts. Some end up just doing breasts. So there's definitely really good surgeons in both parties.
Beautiful. One of the things that I want to ask you is, so I've had a lot of plastic surgeons on the show, and one of the things that is very common that I hear from them and that I've seen myself, and I'm curious to see if it's the same for facial
Mhm.
plastics, is cosmetic surgeons encroaching on body surgery, liposuction, breast augmentation, those types of procedures. Do you see a lot of cosmetic surgeons who are going into facial? I'm super curious because I can't think of anybody off the top of my head, but I'm curious if that's happening. I'm almost sure it probably is, but maybe
Yeah.
it's not.
Well, I think with any field, right, when there are attractive procedures that seem fun, there's always going to be practitioners that want to try to expand, right? I would say for facial plastics is probably a little bit less compared to what I see with body, and I think just because the barrier to entry is a little bit higher, in the sense that cosmetic surgeons can take a weekend course and learn to do some liposuction and do a reasonable good job. They're not going to replace, those very complicated body plastic surgeries, the flaps and stuff. But it's a lower barrier to entry. But like, let's say you take rhinoplasty, that's a really hard surgery for someone who doesn't have a background in it. It could be very daunting. I imagine people probably wouldn't want to just pick that up. Areas where I see maybe a little bit more dabbling, it maybe like liposuction on the neck, maybe a little mini facelift. But for better or worse, I think facial anatomy is very complicated. There's a lot of nerves and vessels and a lot of functions that you need to make sure you maintain and preserve. So fortunately, I think most of the surgeons that I see are all appropriately trained and board certified for facial plastic surgery.
I'm happy to hear that. I kind of was thinking that it's probably a little too hard for them to just get into it and start doing it. So I'm happy to hear that it is a higher barrier to entry.
And everything we do is on display, right? You can't hide the face, so it's definitely higher stakes in my opinion. So I think it's just you have to feel very comfortable to offer these kind of procedures.
Absolutely.
Yeah.
Well, I'm really thankful that you came on the show, Dr. Delaney. If my girls want to come see you, where can they find you? Oh, wait. I have a question because
Okay.
I asked this to all of my surgeons that come on the show.
Yeah.
And most of them are body surgeons, but I know that it also applies here. Are you using drains? Are you team drains or no drains in your surgeries? Do you use drains in your facial facelifts?
That's a great question. So it's been kind of a journey now, right? Um, I was trained to use drains, and I still use drains now, but I'm changing my facelift a little bit. I'm doing what's called a preservation facelift. So the subcutaneous area is smaller, and really the subcutaneous area is where you need to have a drain, because the deep plane you don't need a drain. And then I'm incorporating this thing called the hemostatic net that reduces risk of more bleeding. So I'm getting very close to letting go of the security blanket of the drain. So I think, if you talk to me in a few months, I may be team no drain.
No drains.
Yeah.
So for now you're team drains, but
Yeah.
you might be changing.
Yeah.
Okay. And if my girls want to come see you, how can they
Yeah.
find you?
Yeah. So we're located in Houston, Texas. Facial Plastic Surgery Associates. Our website is todaysface.com. And you can also look me up on social media, Sean Delaney, MD. And we're happy to see you guys.
Yay. Thank you so much for being on the show, Dr. Delaney. And with that, I'll see you guys next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team.
You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.